While St. Lucia is noting a steady reduction in COVID-19 cases, the number of deaths is slowly rising. As of Thursday, March 11, 2021, St. Lucia recorded 47 COVID-19 related deaths. Most suffered from other health ailments. 81% of the deaths are male, and the majority of cases fall within the age range of 60 to 64. Chief Medical Officer Dr. Sharon Belmar George revealed that diabetes, heart disease, and high blood pressure were present in most of the COVID-19 related deaths. She says treatment is based on the patient's comorbidities and their condition when taken into care.
We also have patients who may be moderate and severe, requiring high-flow oxygen. We're also using steroidal treatment. We use supportive treatment, such as we give zinc, we give vitamin C as well. And like I said, the high-flow oxygen, many of the patients come in some level of respiratory distress. And like they have presented before, the need for continuous oxygen has increased with the wave that we were managing, since they did have an increase in patients who were admitted there. And then based on what other underlying conditions, if they're hypertensive, if they're diabetic, if they're recovering from a stroke, based on what they come in with, their treatment would be related to their comorbid condition.
The Chief Medical Officer warns that a steady rate of decrease in the island's positive rate is no excuse to gather socially and let up on health protocols.
We still have, like I indicated, over 100 active cases, 152 active cases within the community, and we would like to bring this number down further before we will feel comfortable. So it is important that although we are pleased with the rate of decrease to date, it is not an indication for us to let our guard down. We still have to ensure we are very vigilant and we maintain all of the measures. It is not an indication for us to socialize or to relax the measures. We still need to monitor very closely, so we maintain the gains that we have seen thus far.
Meanwhile, over 14,000 St. Lucians have been vaccinated in over a 2-week period. There have been concerns of a discrepancy in the vaccine stock and the number of people vaccinated. Immunization Manager Tekla Jabatis explained that the Health Ministry decided to administer the first doses and extend the interval for the second jab. Additionally, the ministry is expecting more vaccines from the COVAX facility.
Based on the guidance, the vaccine committee, we can decide to extend the interval for persons who would have had the initial set of people who would have received the vaccines, because initially we started off with an interval of 6 weeks. But since the new guidance, we have since opened up our interval to 8 weeks, to every 8 weeks. So yes, we will continue administering first dose with our 23,000 doses of vaccine. So as soon as we receive our first tranche from COVAX, which would really be our second batch of vaccines into St. Lucia, then we will start off with our second doses.
As it stands, Castries, Grosile and Babuno have recorded the highest number of COVID-19 cases. Although 54% of St. Lucia's cases are females, health officials have noted a 2% decline in the number of females affected by the virus from the last reporting period. Gina Filippi, HCS News Force.